Good afternoon. My name's Mike Masding. I'm co-chair of the UKFPO, and I'd like to welcome you to the first of the UKFPO webinars that we're doing this current academic year. We aim to do a number of these webinars throughout the year on a variety of different topics, and we hope that you find them interesting and stimulating. The topic for today is safe prescribing, with a focus a bit later in the session on the script e-learning modules. If you have any questions or comments that you'd like to make about the content and any queries you have, then please put them into the Q&A tab that you'll see on the Teams meeting, and we will answer those as we go along. The way that the session will work is I'm just going to do a few minutes about why prescribing is important. I'm sure in your career already you've discovered this, but just give you a few stats and facts about the sorts of things that make us worry about prescribing. And then our UKFPO fellows who've just started as F2 doctors are going to talk about how you might evidence prescribing in the e-portfolio. It's a very important skill, so it's important that to complete your foundation program, we're happy that you can do it safely. And then Hannah from the script team is going to come and talk about the script modules and how you can get the best out of them. So why prescribing is important. I've been a doctor for 32 years now, as of last week or 2 weeks ago. And throughout that time, I've prescribed. I can't think of any clinical setting I've worked in where I haven't been doing that. And in many ways, all doctors will do it at some point in their career. And lots of us will do it throughout our career. Regardless of what specialty we do, we will prescribe different things. Of course, the prescribing landscape is much more complicated than when I started as a doctor. In those days, literally only doctors could prescribe. But now, of course, there's lots of other healthcare professionals who do it too. So, for instance, the diabetes specialist nurses in my team, I'm a diabetes consultant. They prescribe. We have lots of other types of healthcare professionals who can do it, and so there are lots of people who can help you with prescribing. It's a complex thing, and I think sometimes, particularly people of my generation, just take it for granted. But it's actually a really complex thing to do, and when you break it down into the composite parts of when you do each prescription, it's actually quite a difficult thing to get absolutely right all the time. A lot of the places you work in, not all, but a lot of them will have brought in electronic prescribing. And certainly there's quite good evidence that electronic prescribing is safer than doing it in a written way, but it's still not completely safe. And that part of that is because of the complexity um, of um, of the prescribing landscape. Every year, lots and lots of new drugs come out. As you go through your careers, you'll become increasingly specialized and you'll become totally familiar with the drugs that you deal with. But other drugs that your patients will be on will come out and you won't know what they are. And indeed, one of the reasons that prescribing is so much more complex now is on how many drugs patients are on. When I first qualified, most patients would be on no drugs when they were admitted to hospital, or maybe one tablet for something. Whereas now you will have already found, even if you've only been working for 2 or 3 weeks, that most of the patients admitted to hospital are on lots and lots of drugs. And indeed, that's the same in primary care too. So we do a lot. We do a lot of prescribing. You do it a lot as a doctor, and look at that number. About every year, about 1 billion hospital prescriptions are in England and Wales alone. And that's a staggering number if you just think about it. So it's hardly surprising that we don't get it right all the time. And we spend a vast chunk of the NHS budget on medications. You can see there. This is from about 2 or 3 years ago. And in England, Wales, and Scotland, £20.9 billion. Of course, it's good for patients. It's important that we prescribe the medications that we give, and often we give them perhaps without quite realizing the impact of them. How good it is for patients that we prescribe. We have a broad range of medications, and that will continue to get wider as time goes on. But of course, it can be bad for patients as well. And medication errors are a significant problem within the NHS. This is sort of almost like random bits of data that I just pulled out for you to. I'm not going to read it out for you, but you can see how common prescribing error rates are. You can see the impact of them taking up over 180,000 bed days. Just think if we didn't have any of those, then flow through the hospital system would be extraordinarily better. It causes deaths, the ultimate outcome, and that is not a good thing, of course. Um, and an interesting study that I found from a renal unit looked at prescribing by F1 doctors, F2 doctors, and then people more senior than this. And part of this is blindingly obvious. The less experienced you are, the more likely you are to make a prescribing error. And that's why it's important that we focus on prescribing, that you learn about it as you go on, and that you're appropriately supported as you go through your foundation program in the prescribing that you make. And indeed, if you just put it, facts and figures are all very well, but if you just put it in the context of clinical practice, last week, as a consultant physician, I was on the wards. I do about 1 week in 5 on the wards, and just reflecting on that last week with two excellent foundation doctors, um, the sorts of things I came across. As a diabetes specialist, I came across two patients who had been prescribed on admission to hospital the wrong insulin. Now, no one will have done this deliberately. No one will have set out to get it wrong, but they were errors that were made that affected the patient, and indeed both the patients will have stayed in hospital longer because of those errors. Part of the problem is the complexity of insulin. Part of the problem is that some of the drug companies won't change the name or the packaging, so that some insulins look incredibly similar. But nonetheless, it did mean that patients were in hospital longer. I was accosted by a patient who said, "I'm on this, this, and this. Why was it not prescribed when I was first came into hospital?" And the answer was, "I don't know." But again, transcription of the drugs that the patient was on in the community had not occurred when they were admitted to hospital. I saw a couple of patients whose antibiotics weren't changed, despite the fact that we knew what the sensitivities of their infections were. And again, this will have prolonged their length of stay. And I saw a lot of patients who were on IV drugs for far too long, and changing them to tablets meant that we could move their care on a lot quicker. And these are just the sort of simple errors. They're not highly significant. Nobody died or got really ill because of them, but nonetheless, people stayed in hospital longer. They were errors that were made, and if we can try and think about our prescribing and how we can make sure it's better, then it will be better for us, and more importantly, it will be better for our patients. So how can we help you be better prescribers? Well, part of that is the sort of webinar like today to really, it's very deliberate. It's the first one we do just to really emphasize the importance of prescribing that you will do as doctors, most of you throughout your career. Certainly, as foundation doctors, you should be supervised. And if you don't know and you're not sure, there should be someone to ask. If there isn't, please escalate it to your foundation program director, your educational supervisor, or somebody. But if you're not sure, ask. The prescribing safety assessment, many of you will have already passed this, but people who are new to the NHS or new to the UK may not have sat the PSA. And I would say that for those of you who are sitting it next month, the very best of luck. Do your best to pass it. The stuff in the foundation program curriculum, which our UKFPO fellows are going to talk about, and how you can evidence your prescribing. And that's not just so that you can get through the year, but actually you can demonstrate to us that you will be a better prescriber than when you started in the foundation program. And then there are the script e-learning modules, which have been around for a little while now, are generally excellent, and give a lot of help for you in your prescribing. So we'll move on with the webinar, but I'll say if there are any questions from what I've said or from what our UKFPO fellows are going to say, please put them in the chat and in the Q&A rather, not the chat, the Q&A, and we will do our best to answer them. So I will stop sharing my screen there, and I will hand over to Jo Fay, who is one of our UKFPO fellows, who's just started with us. I'm delighted to be working with her and Dasha, our fellows, and they're just going to talk a little bit about how you can evidence your prescribing skills in the foundation program.
Hello. Just wanted to double check that everyone can see my PowerPoint slide. Can everyone see?
Yeah, we can.
Okay, brilliant. My name is Jeffrey, and joining me is Dasha. We're both FY2 doctors based in Manchester, and we're UKFPO fellows for this upcoming year. So, Dasha, do you want to take the start?
Thank you. So hi, I'm Dasha. I'm one of the other UKFPO fellows alongside Jay Fay, and we're talking about how to evidence prescribing in your e-portfolio. So I think it's important to recognise the wide range of things that you can put into your portfolio and show it throughout. So the main ones we're going to be talking about are the SLEs. And the main three kind of you'll recognise throughout are the case-based discussions, the mini cases, and the reflections. So I'm going to be talking about the examples that I included in my portfolio, and then I'll pass on to Jay Fay as well into the way that we can also show it onwards. So example topics. So the first topic that I included was actually dosing and calculation. So then if we go next, there you go. So we were talking, so I had a case-based discussion, and this included a discussion with the pharmacist on the ward. So I think it's important to recognise that actually when you are including case-based discussions or mini cases in your portfolio, it doesn't always have to be a doctor. It can be another relevant, appropriate healthcare professional. So for example, it was appropriate to have a pharmacist, and we had a fantastic conversation. I wasn't entirely sure about how to prescribe the Ferinject as the second dosing, was a little bit confused. And I went to the pharmacist, we had this conversation, they showed me the policies that are available on the website, how to calculate the appropriate dosing. So that was the first example. The second example was pain management. And it was an interesting scenario because I encountered a patient that had been using a wide range of analgesics over their period in hospital, but also prior to coming into hospital. So kind of the level that they were used to was much, much higher. The tolerance, I think, is the appropriate wording. So it was an analgesia-dependent patient, and they were still in pain. And it was a very difficult scenario because we're very limited to what we can provide the patient. So again, it was more of a multi-team approach, and I kind of was coordinating between the different specialties, between the different healthcare professionals. I was talking to the medics, I was talking to the specific pain management teams of specialty, was talking to the pharmacists, to kind of bring everyone together to coordinate and to kind of come up with the most appropriate management plan for this patient to support them as best as we could. And again, that's another kind of example of how prescribing can be referenced and it can be used as a CBD. The next example that we came across was palliative end of life. And again, that's another form in which you'll be prescribing medications in your e-portfolio or in general as you'll be coming across it throughout your career in F1 and F2. And it was prescribing the anticipatory medications. It's how you approach the end of life, the dying patient. How do we support them most appropriately? It's prescribing the PRM medications when it's relevant. It's supporting not only in the pain, but many different aspects of this, and whether it's from the secretions, allowing them to be a little bit more calm. It's a concoction of things. And I think people have very different approaches, but it's ensuring that you provide the patients with kind of the most appropriate support towards the end of that life and make them comfortable. And again, you can look at all that prescribing, you can think of a range of approaches, and it's looking at those examples, it's discussing them, it's also reflecting upon those examples, because I think there's the reflections, we'll talk about it afterwards, but there are the reflections within each case-based discussion or other SLE or at the actual separate reflections. And again, it's up to people how they want to do it, but I think you can approach it in two very different ways. But it's important to not only have those discussions and learn and develop, but also to reflect on those scenarios, because we're doing it every day to day. And again, palliative care teams, so you can work with many different teams. I've mentioned the palliative team, the pain teams, and again, they will support you with your prescribing, the knowledge, the awareness, the development of everything. Next slide, please.
Yeah, I'm happy to take over from here. So there are many ways we learn about prescribing. I think just your day-to-day work activities will more than enough sort of equip you with learning experiences through making small mistakes or making um, or nearly making some medication errors. Those are the ways that we sort of learn and then and I think the more importantly, learn and reflect on why those mistakes almost happen or happen and how we can prevent those things from happening again. Um, just to kind of clarify, if in case you're not fully aware of what we mean by SLEs, mini Kexes, CBDs, just because these are acronyms that are once you've gotten more familiar with horrors will make more sense. But for those who don't know, SLEs stand for supervised learning events, and they include, it's an umbrella term for things like CBDs, which are case-based discussions, where you will usually discuss with a senior, usually a registrar or a consultant, and you can talk about, uh, you know, what is usually a patient encounter, or in this case, it can be, a prescribing sort of related learning event, and then they can give you some feedback, and you document all that. So that's a CBD. The mini CACs is one where the senior supervises you doing, say, a history or examination, or watching you. Um, yeah, basically they have to directly supervise you doing that activity, and then they can give some feedback. So CBD is something that they don't have to watch you. It's something that is retrospectively discussed. Um, and I suppose the DOPS, which is direct observation of procedural skills, is more to do with practical skills. So, if say you do cannulation or phlebotomy, or, relevant to this, if you set up, IV fluids or prescribe certain controlled medications, you could get someone to observe you do that and make sure that you're, you know, doing all the things right, right patient, right dose, right medication, and give some feedback if necessary. So I just wanted to clarify that. So when it comes to learning about prescribing, uh, two ways that we learn it as foundation doctors would be online, through e-modules, and the other will be in person, through our weekly mandatory teaching. So this is just a snapshot of what's available on the Horus portfolio. So I didn't know about this until like halfway throughout FY1. So if you go into the curriculum, you would find that under the HLOs, which I think stands for Higher Learning Outcomes, there will be a little uh, tab on the, if you can see the top right corner, it says ELFH. So that's just, it stands for e-learning for healthcare. And if you click on that, it should bring up this whole list of e-modules that you could do, and it will redirect you to the ELFH website. And the cool thing about this is once you've done these e-modules on that website, it should sync up with your Horus portfolio. So it will then show up under your curriculum to demonstrate that you have done these e-modules, you've taken time, outside of your work setting to read up about, and you can see that there are lots of modules available which are related to prescribing, and if you scrolling through, you'll find that almost every bit of the foundation curriculum would involve learning, how to prescribe safely, and the complexities around prescribing, to put it simply. And so it's quite helpful, for your learning primarily, but also if, when, because evidencing these things on your portfolio is important, for your ARCP. So, if you're finding that you're running out of things to include in your portfolio, showing that you've done these e-modules is a good, what do you call this, supplement, if you will. And you can see that under almost every higher learning outcome, there are tons of e-modules that you can do, and they're very helpful, especially the ones with insulin, anticipatory meds, end-of-life care. Those are things that I think as FY1 doctors we do tend to struggle quite a lot, and we do tend to rely a lot on our healthcare colleagues like diabetic specialist nurses and palliative care team, which is great, and it's not a bad thing. But I do think that as doctors, we should, these are our also our bread and butter, aren't they? So we should develop the confidence to do that as well. The other thing to say, so in-person teaching usually is a weekly mandatory half-day teaching, and this is a snapshot of what it looks like on Horus. What I didn't include down there were the list of learning sort of sessions that I had throughout FY1, but it's pretty self-explanatory. If you go onto the personal learning log, you can just log every session, and I would recommend that you log each one as an individual event. So if you say you had an hour-long teaching on prescribing in end-of-life care, then you should put a title as end-of-life care prescribing, put how many hours it is. You can write down what you've learned from it and just log it on. So, and you can also link this back to the curriculum. So once you've logged it here, it can, and if you link it to the curriculum, it will show up on the curriculum as one of the things that you've done as well. So that's the other way. And that's all we have for today from our point of view. And I'll stop sharing so I can see if there are any questions.
Thank you, Dasha and Joe Fay. Excellent. I don't think there are any questions as yet, but if anyone in the audience has, in the live audience, has any questions, please put them in the Q&A tab, and we'll answer those. So we'll move on, and it's a pleasure to introduce Hannah Valance, who is a script e-learning manager and a clinical pharmacist, and she is going to introduce the script modules, and we'll talk about what you can get out of them. So thanks very much, Hannah.
No problem. Just share my screen. Okay, thank you very much for inviting me to speak today. I'm going to provide you all with a very brief overview of the Script e-learning programme, because I'm aware potentially quite a number of you in the audience may have already encountered the programme at undergraduate level, or may have been asked to register as part of your induction into your foundation training. So I am one of a team of healthcare professionals that's based at the University of Birmingham, and our primary responsibility in terms of the Script programme is to look after the clinical content. We work in partnership with a media company, OCB Media, and they're responsible sort of for the technical delivery, but my primary role, along with my colleagues, is to look after the clinical content. So I thought I'd just provide a very brief overview about our learners and where the programme has come from. It actually, as Mike suggested, has been going for quite a while now. It was back in 2010 that it started as a regional programme just within the West Midlands. It came a bit out of the EQUIP study, and I think one of the figures was in Mike's slide, that found that around foundation trainees prescribe with an error rate of around between 8 and 10%. And obviously a significant number of these don't result in any harm to the patient, but a small number of these do. So there was lots of discussion about what could be done. And one of the ideas that was come up within the West Midlands region at the time was that there was no standardised postgraduate training available in relation to prescribing and therapeutics within the region. Some of our trusts were excellent, provided loads of training for foundation trainees, and other trusts weren't so good. So the region decided that they wanted to create this collection of modules to provide to foundation trainees that could supplement their teaching that they get. And over time, we've expanded across the entire UK. So as you can see, the modules now are available to anyone with an NHS email address and anyone with an AC email address, and that's the same for e-learning for health. We work in partnership with them. So both modules that Jofo mentioned, they're available to anyone with an NHS email address. In terms of script, we have over 125 modules that span the NHS workforce. So some are tailored more towards our nursing colleagues, some are more for pharmacists, some are more focused towards paediatric specialist trainees, some are towards our dental colleagues. And last year, the data showed that 95% of foundation trainees, doctors, use script in some capacity, so registered or engaged with the programme in some way. We have over 16,000 users at a medical and undergraduate level, which I think perhaps a lot of the audience will have encountered script as institutions have now embedded the PSA. Script is used alongside to support preparation for that, and I'll talk a bit more about that later on. We've had over 1 million modules completed across all our portfolio since it was launched, and as I touched on, it's available to all staff. So it's not just a resource that's available to support your foundation training, it is available to anyone within your team as well. The main aims of the programme were predominantly to encourage safe, effective and rational prescribing, and as I previously mentioned, to standardise prescribing education across the NHS workforce. It's not in any way meant to replace face-to-face teaching opportunities. It was just simply meant to be there as a baseline level of what trainees could access in terms of teaching if their particular region or trust didn't provide as much prescribing education as perhaps others did. And it was also a platform for learners and supervisors to engage during ARCP discussions, because the supervisors can actually look if you've used the resource, how long you've spent on the learning, and how you've engaged with it, and if you found it helpful. So it was also supposed to initiate discussions around prescribing. So the programme itself, I'm just going to touch on a few things to do with the modules. So it's designed to allow just-in-time learning. So all of the modules are allowed, they're all open, so you don't have to complete them sequentially. You can dip in and out of different topic areas. They're not locked down. You can just, I don't know, go into the respiratory module, and if you particularly want to look at the acute management of asthma section, you can go to that straight away. You don't have to follow the module through to get to that section. The module will always keep a timestamp of how long you've spent on the learning. So you can, if you close the module down properly, it will keep a record of how long you've spent there. And then you can just pick it up and it will remember where you were, and it will have recorded the pages that you've visited. All of the modules are authored by an expert. So this will be either, usually if it's a therapeutic topic, it will have been authored by a specialist consultant in that area. If it's to do more with principles of prescribing, it would perhaps be a specialist pharmacist that may have authored those particular modules. And all the modules are kept up to date. So as the editorial team, our job is to make sure that all of the modules are reviewed on a triennial basis, but in between that time we will be making sure that the modules are regularly reviewed and updated in line with any new guidance that comes out. So for example, earlier this year there was already a lot of regulation to do with sodium valproate prescribing, but they introduced even more measures, so we had to make sure that all our modules reflected the new restrictions around prescribing that particular medicine. Most of the modules, not all of them, will have an associated pre and post test, and this is really sort of for you to use to identify your own knowledge acquisition, see what your baseline knowledge is on a subject area, and then perhaps hopefully once you've looked at the content, any improvement that you've gained as a result of the learning. The content should be compatible with all NHS IT systems and mobile platforms now, although it's not particularly, we don't have an app available, so it's not brilliant on a mobile, but it should work perfectly well on a tablet or Mac or any laptop. We have certificates that are available at the end of each module as evidence of module completion. Although we work with eLearning for Health, we are a separate platform, so the certificates won't pull into your portfolio in the same way, but they are kept on your profile. So should you ever need any evidence that you've completed a module, you can download the PDF version of the certificate and upload it to your ePortfolio. And then we have a technical and editorial team that's available for support. So the technical team will deal with queries if you don't feel it's registered the amount of time you spent on the module, you can't remember your password, or you can't having issues logging in or anything like that. And we'll deal with obviously anything that's more content related. So sometimes users or contact us to say a particular URL is no longer working. So we can go in and update those kinds of things. The particular portfolio that you will have access to, and you may have used at undergraduate level, is our medicine and surgery portfolio. So within this portfolio, we have 55 modules that cover a wide range of subjects in prescribing and therapeutics. When you go into the programme, you will see that these modules are further divided down into categories, so you won't just be faced with a massive long list of 55. Hopefully you'll be able to navigate your way to a particular topic area that interests you. So we'll have in our principles of prescribing category, for example, we have modules on prescription documentation, utilising the BNF, which may seem fairly basic, and you'd think you'd hopefully be able to do that, but it's just highlighting issues such as making sure you read the whole drug monograph when you're looking at drug dosing, because sometimes the BNF doesn't make it particularly clear if it's dosing milligrams per kilogram or milligrams per dose, which obviously is very important for the patient in terms of working out their total daily dose that they need. All of the modules will have clear learning outcomes, and these are highlighted at the beginning of the module. And I've just put a screenshot up of one of our modules. I think it's the renal module, in terms of a page that might look familiar to you. As I touched on before, all of our modules will have a certificate. These will be date and time stamped, and they will say what module you've done and then the learning outcomes you've achieved as a result of doing that learning. There'll be no pass mark that's put onto the certificate, because we're not as a team claiming by doing this module that you're then competent in that particular topic area. We're just saying that by doing the learning, you should have met the following learning outcomes. And as I mentioned, it's always downloadable and available on your profile. I just thought I'd include this for any trainees that haven't previously registered with the programme and would be interested in looking at it. The URL is there for you. If you have used it before, perhaps at undergraduate level, and you want to continue using the resource at foundation level, if you log into your profile, on the top right hand corner, if you click on the drop down, there's a transfer request. I do recommend you do that, because universities are quite eager, shall we say, to archive their students that have graduated, and then you might lose, it'll be more troublesome to get your profile back. Whereas if you do a transfer request, all of your module statuses that you've completed, they'll all remain on your profile as you move into F1 and F2. I was asked to briefly talk about script and the prescribing safety assessment. I know most of you will have probably passed this, but I just wanted to highlight for those that may be sitting it later next month. So in terms of the PSA themes, some of the script modules have been mapped to the themes, and this was done independently from the script programme. It was done by a health education team based in Kent, Surrey and Sussex, and they looked at the PSA themes, and then they mapped across the script modules that they felt would be helpful for users whilst they're preparing to do the PSA assessment, as well as obviously utilising the PSA practice questions that are on the website. So this will be particularly useful for anyone that has got to sit the prescribing safety assessment. I just thought I'd briefly use this opportunity to talk a little bit about the feedback that we get on the programme and what we're doing as a team to address this. So as I mentioned, the programme has been going for a long time now, and as you can imagine, technology is just changing exponentially at the minute. So content that was perhaps fit for purpose in terms of how it looked 5, 8 years ago no longer is. So this is a recent example of some of our content, and whilst accurate, it's perhaps not the most engagement, reflecting perhaps more of a textbook that you could download rather than sort of traditional, more modern e-learning. But we've been working hard to update the slides here. It's the same information, but just hopefully presented in a slightly more engaging way to the users. One piece of feedback that we had from, I think it was students based at King's, they said they were sometimes confused about the session key points that were presented at the module. They didn't know exactly what content tied in with those session key points. So as a team, we've been going through and we've been putting the session key points into these orange boxes to make it really clear within the content. As I mentioned, because we've got a large number of modules, we've been doing this every time the module is due its triennial review. So it's taking us a while to get through. So you may notice some in the older style that don't do this, but increasingly more and more the session key points will be highlighted in this way as you go through the learning. In terms of common themes, we get in terms of the feedback. So when you complete a script module, there's a feedback form that we ask if you can complete. We welcome any feedback, positive or negative. We just ask that if it is more negative feedback, if you could make it constructive so that we can actually action it and implement a change. We do actually read all of the feedback, and I think having read some of the responses, sometimes people think it's going into a black hole, but we do read it all. We get it sent to us on a monthly basis. So there will be a lag period if we respond to you, but we will get back to you if you need any feedback. We get quite a lot of feedback relating to the mandatory natures of the module. So I just wanted to express to you all today that as a script team, we don't put any requirements out in terms of mandating modules or any expectations that you complete any modules during foundation training. We think they're an excellent resource, so obviously we strongly encourage that you access the resource, but if you're getting any direction in terms of you must do X, Y, Z module in order to pass or progress, that's actually that's been a regional decision that's implemented that, or perhaps even your local trust has said you need to do that. So whilst feel free to vent in the feedback form, there's very little that we could do, so perhaps you need to also feedback that to your local region. And the same with the minimum time spent on the modules. So this programme is actually funded by NHS England, and they have stipulated that it's not possible to go through the module if you've spent less than 10 minutes on it. So they asked us to put a 10-minute time on the module, time spent on the module. So you can go, if you skip through the module in less than 10 minutes, quickly complete the post-test, you'll then fail the module. And that's the reason why, because NHS England have said that's not acceptable. If you're going to do it, you need to spend at least more than 10 minutes on the module looking at the material. So if you then have to reset your module to go through it again, just be aware that your clock will go back to 0. So you can't then go through and skip. You'll have to spend at least 10 minutes. Pass marks, I touched on this earlier. As a team, we don't set a pass mark, but there is functionality within the system for pass marks to be set. So if you do have a pass mark associated with the modules, which should have been communicated to you at a regional level, that's been your region that's decided that they want you to achieve 70–80% in the post-test in order to pass the module. Again, feel free to write on the form, but perhaps that sort of feedback needs to go to your local region. You can reset any of the modules. So once you've completed the module, you can go back into it at any point and see any of the content. Like I mentioned, they're not locked down, so you can just go, if you've done the module on, I don't know, just trying to think, let's use diabetes as an example, and then you think, oh, I just want to go back and look how to manage this in the perioperative period. You can just go to that section of the module easily. That's absolutely no problem. Sorry, excuse me. But if you reset the module, you'll have to do the pre-test again, and then you can access the content and then move around as you did before. The other piece of feedback we get quite a lot of related to is accessibility. As I mentioned, our modules, well, the programme was developed a long time ago now, and obviously increasingly accessibility has been a big issue. So we are currently in the process of designing a new template, which will mean all of our modules are AA compliant, and they'll work a lot better with screen readers and stuff like that. They currently do, but only with certain screen readers. So I would advise that if you're having any issues in terms of accessibility, please do contact our IT support team, and they'll be able to direct you to screen readers, or if you need to change your dark mode settings or anything like that in order to access the material, and they'll be able to support you with that. We get a lot of feedback in terms of layout, which I discussed earlier, which we've been trying to address, and length of module. Please do feel free to let us know if you feel the module's too long. We can look at the average time spent on the modules, but it's really helpful for us, and we do act on that. So recently we've been splitting quite a number of our modules to try and make them more bite-sized. Obviously we won't act on one individual user's feedback, but if more and more of you do let us know, then we'll perhaps focus on those modules more. And finally, the last thing that we'll obviously get through the feedback form is any information on the clinical content. So it might be, as I mentioned, if links are out of date, if I don't know, there's old terminology used. That happened last month. One of the users emailed us and said that they'd come across the term anti-epileptic drug in one of our modules. I can't think what it was now. We'd obviously changed the terminology to anti-seizure medicine in our epilepsy module, but we must have mentioned a random anti-seizure medicine elsewhere and it hadn't been picked up there. So that was really helpful. In terms of our being able to respond as a team, we can, if you email us with information relating to the clinical content, we can, if we feel that it is necessary, we can get that updated to users the same day. So we're really fortunate that we can respond really quickly to anything like that. And sometimes users just misunderstand the content. So the content is accurate, but them misunderstanding it actually provokes us to go and review it and think, well, okay, how was this misunderstood? And we might make changes to the content as a result of that. I've put these contact details up. So the top one is our main website. The first email address is the one that's particularly useful if you're having any issues to do with technical issues, password resetting, anything like that. Clinical queries is best to come to the Birmingham email address, and one of our team will get back to you. Even if we can't give you an answer straight away, we'll probably respond within 24 hours to say we're looking into it, and then we'll get back to you. And then finally, if there's just any questions.
Thank you, Hannah. Thanks very much for taking us through the script modules. As Hannah said, I've been around a little while. I remember well when they were introduced, and I did some of them to see what they were like, and I thought they were excellent. So I would heartily recommend that all foundation doctors throughout the UK, it's open to everyone, regardless of what trust or hospital board you're working in, regardless of what country you're in the UK, you can access the script modules. You have to sign yourself up. So please do that. Hannah's talked about if you're already on there and want to move one, transfer one account to another, how to do that. We will put these slides up on the UKFPO website and have recorded this webinar, and it'll go onto our YouTube channel that you may well be watching via that modality as I speak. So you will have the opportunity to see those things. But I'd really, really strongly recommend that you do some script modules. Spend some time doing them. It's a really good way, as well as some of the things that JFA and Dash has talked about, of evidencing that you've done some stuff around prescribing. Hannah, a couple of questions. Firstly, you did mention about how long it takes to do the modules. Have you got any sort of feel for about how long an average module takes?
Our data shows that most users spend between 30 and 40 minutes. Some of the bigger modules do take an hour. particularly if users want to go and read, if we've linked to like the drug safety update related to what we're talking about, and they want to go and thoroughly read all that information, which will obviously increase the amount of time spent on the learning. But about roughly our back room data, if you like, so there's about 30 to 40 minutes per module.
Thank you. And is there any plan to be able to get the certificates automatically through into the portfolio, or is that maybe a step too far with some of their IT systems?
It's happening as we speak. I couldn't give you a timeline on when, but yes, the IT company are talking with NHS England about how we're going to do that.
Fantastic. There aren't any more questions or have come up in the Q&A bit, but so it just comes to me to thanks very much, Hannah, Jeffe, Dasha, for your contributions this afternoon. Thanks very much to the UKFPO team for putting the webinar together and doing all the backroom stuff. And just again to reiterate just how important prescribing is. That is one of the reasons that the passing the prescribing safety assessment is one of the outcomes of Foundation Year 1. It's the reason many of you will have done it at medical school. It shows how important prescribing is. Doing the script modules and the emphasis we put on doing the script modules shows how important prescribing is. And you will make errors. I'm sure I make errors all the time in prescribing. The importance, as already been touched upon, is that we learn from those and don't make those errors again. And if, like most things in the Foundation programme, if you're unsure, then please ask your supervisors for advice, and I'm sure they will give you that. So I wish you all continued success in your Foundation programme, and I look forward to seeing you at the next webinar. Have a good rest of the day.